Hi, my name is Michelle Danda. I'm a registered nurse. I'm a full-time PhD student at the University of Alberta. I've been a nurse for a little bit more than 12 years. Myself being racially ambiguous, having a white dad and a Filipino mom, I've experienced subtle and overt racism. I started to experience it when I was a nursing student. In my final practicum of nursing school, I was in a young offender center. A lot of the staff in that facility were also Caucasian. A lot of the population, like a lot of the youth in that facility, were Indigenous and were people of color. And my preceptor at the time, throughout that practicum, I would hear derogatory comments about the youth that were there, calling kids natives, all kinds of things that I didn't expect, especially going through the nursing program and learning about things like the social determinants of health and how race and ethnicity and poverty all impact the healthcare experience. One really salient memory I have is I was sitting with my preceptor, and at one point in the conversation, he said that she works with those lazy Filipino nurses. And I remember just sitting there thinking, my mom is Filipino. My mom was also an LPN. Like, you're talking about my mom. And that was when it really crystallized for me that there is more to this. It's not just me. There is some systemic racism. The racist overtones in the United States seem a lot more overt. And by comparison, Canada, we've had this overarching view that, well, we're very multicultural, we're very, it's a mosaic here, we're very accepting of all ethnicities, all races. But at the same time, there's still a lot of underlying, more subtle racism. We just don't talk about it. I don't know if we're afraid to talk about it, or we've just really deeply internalized this multicultural perspective where we think we've dealt with it. We don't have to talk about it anymore. In Canada, there definitely is racism. I feel it, I experience it almost on a daily basis, but we don't talk about it. I think as nurses, we're obliged to start a conversation about racism because we're the front line. We're the direct care clinicians. We're the ones that are with people in crisis, especially in a lot of the major cities in Canada with such large immigrant populations and such large refugee populations. I feel like we're obliged to have those conversations because those are the patients that we're with every day. In Canada, we also have quite a few nurses from overseas, nurses that immigrate from other countries, especially places like the Philippines. My mother was one of those nurses. I have a lot of family that are those nurses. Those are the people that we're working side by side with. Those are our colleagues. We have to say something. We can't just be silent, and we can't wait for someone else to take the lead on it. We have to start noticing when our colleagues are being racially discriminated against, when policies or practices are discriminating against certain patient populations. We have to start having those conversations about how we can make it better and more socially just. One of the statements that I hear a lot in the workplace is, I'm colorblind, or I don't even see color. It's invalidating the person and saying, I don't believe that you're experiencing racism. That statement somehow erases the fact that there is racial inequality and inequity. I think that we have to start acknowledging that the system is not colorblind. In BC, we don't take a lot of data about ethnicity of patients. There's a lot of resistance to that. Why would their ethnicity be important to their healthcare? But actually, we're not in a colorblind world. So as long as we're not taking the data, as long as we're not noting that people have different skin colors and different ethnicities, and that this is affecting the way that they interact with the healthcare system and their healthcare outcomes, then nothing's going to change.